Your morning has a rhythm. You know it so well that you barely think about it anymore. The alarm, the stretch, the bathroom, the coffee, perhaps the news, perhaps the phone. The sequence is so automatic, so deeply embedded in the muscle memory of your daily life that it happens before your brain is fully awake. And that is precisely the problem. Because in those first 30 to 40 minutes after you wake up, before you have gotten dressed, before you have sat down to breakfast, before the demands of the day have officially begun, your blood pressure is doing something that most people over 60 have never been told about. It is spiking. Not because of stress, not because of exertion, because of biology. And the habits you have built into those first 30 minutes are either helping your cardiovascular system manage that spike, or they are amplifying it in ways that compound day after day into measurable and lasting damage to your heart, your kidneys, and your blood vessels. 5 specific morning habits are the most consistent amplifiers of that dangerous early morning blood pressure surge. 5 habits that are completely ordinary, that billions of people perform every single morning without a second thought, and that are, for adults over 60, quietly working against the cardiovascular system at exactly the moment when the cardiovascular system is most vulnerable. My name is Dr. Favor Clinton. I have over 10 years of clinical experience in internal medicine and cardiovascular health, and I want to have the conversation with you this morning that most medical appointments never make time for. The one about what happens to your heart and your blood vessels in the first 30 minutes after your alarm goes off, and what 5 specific changes, none of them dramatic, none of them expensive, could make a measurable difference to your blood pressure every single morning for the rest of your life. Stay with me through all 5, because some of them will surprise you, and all of them are actionable starting tomorrow morning. To understand why these 5 habits matter so much, you first need to understand what is happening inside your cardiovascular system the moment your brain begins to wake up. Because without that context, the habits themselves seem like small things. With it, they become urgent. While you sleep, your body operates in what physiologists call a low arousal state. Your heart rate slows, your blood pressure drops, your stress hormone levels fall. The sympathetic nervous system, the branch responsible for the fight or flight response, quiets down, and your body uses this window of reduced cardiovascular demand to perform critical overnight repair work on the arteries, the kidneys, and the heart itself. But here is what most people do not know. The moment your brain begins waking up, even before your eyes open, even before your alarm sounds, your body begins flooding your bloodstream with 2 hormones, cortisol and adrenaline. They do not wait for you to be conscious. They begin rising approximately 60 minutes before you are fully awake, reaching their peak surge in the first hour after waking. Those 2 hormones do 3 things to your cardiovascular system almost simultaneously. Your heart rate accelerates, your blood vessels constrict, and your blood pressure rises. This is called the morning blood pressure surge, and it is a documented, well-studied phenomenon that cardiologists have tracked for decades. Studies published in the American Heart Journal have confirmed that heart attacks are between 40 and 70% more likely to occur between 6 and 10 in the morning than at any other time of day. It is not coincidence. It is the morning surge meeting a cardiovascular system that, in many older adults, is already operating under strain. After 60, this surge is more consequential than it was at 40 for 3 compounding reasons. The arteries are stiffer and less able to accommodate the sudden pressure increase elastically. There is frequently plaque present in the arterial walls, plaque that the morning surge can crack or destabilize. And the blood itself is thicker after overnight dehydration, placing a higher workload on the heart at precisely the moment when hormonal pressure is at its peak. This is the cardiovascular environment that your morning habits either protect or assault. Here are the 5 habits that assault it most consistently. I want to tell you about a patient I will call Franklin. Franklin was 72 years old when his wife brought him to see me after his second episode of morning dizziness that had caused him to grab the bathroom counter to steady himself. He was a retired mechanical engineer, precise, analytical, and completely committed to his health management. He took his blood pressure medication at the same time every morning. He exercised 3 times a week. He had eliminated table salt from his diet 2 years earlier after his GP advised him to. By his own account and by the clinical evidence available to me, Franklin was doing most things right. His evening blood pressure readings, the ones his GP used to evaluate his medication effectiveness, were consistently within target range. His HbA1c was fine. His cholesterol was managed. He had every reason to believe his cardiovascular health was under control. When I asked Franklin to describe his morning routine in precise detail, starting from the moment his alarm went off, what he described was a sequence that contained 4 of the 5 habits I am about to share with you. Not because he was careless, because nobody had ever told him that those specific habits in those first 30 minutes were working directly against the cardiovascular system at exactly the moment when it was most vulnerable. We identified the 4 habits. We made 4 targeted changes to his morning routine. None of them required medication adjustment. None of them required dietary overhaul. They were changes to sequence, timing, and behavior in the first 30 minutes of his day. Within 8 weeks, his morning dizziness had stopped. His home blood pressure readings in the morning, which he began tracking at my request, showed a consistent reduction in that dangerous early morning spike. His GP noticed the improvement at his next appointment and asked what had changed. Franklin told him about the morning routine changes. His GP had not heard of most of them. That is the gap this video is designed to close. For you, starting tomorrow morning, this is the habit that Franklin performed every single morning without exception, and it is the one that carries the most immediate and most dangerous cardiovascular consequence of all 5 on this list. When you are lying flat in bed, your blood is distributed relatively evenly throughout your body. Your heart is pumping against a balanced circulatory load. The moment you stand up, gravity pulls a significant volume of blood downward, toward your legs and your abdomen in a matter of seconds. Your heart must respond instantly to maintain adequate blood pressure to the brain. It does this by constricting blood vessels and accelerating its rate. In a younger cardiovascular system, this reflex is fast and precise. The vessels respond within seconds. Blood pressure is maintained. The transition from lying to standing happens without incident. But in adults over 60, this orthostatic reflex slows down considerably. The vessels do not respond as quickly. Blood pressure can drop 15, 20, or even 30 points within seconds of standing. Doctors call this orthostatic hypotension, and you may recognize it as the gray, dizzy, momentarily unsteady feeling that many older adults experience when they first get up in the morning. Here is the dangerous intersection that most people never understand. The orthostatic blood pressure drop happens at the same moment that the morning cortisol and adrenaline surge is driving blood pressure upward. The cardiovascular system is simultaneously experiencing a hormonal pressure spike and an orthostatic pressure drop. In a vulnerable heart, the compensatory mechanisms that try to manage both of these competing pressures simultaneously can trigger arrhythmia, crack arterial plaque, or, in serious cases, precipitate a cardiac event. The fix is simple and costs nothing. When your alarm goes off, do not move immediately. Stay exactly where you are. Take 3 slow, deliberate breaths in through the nose and out through the mouth. Then roll to your side. Push yourself to sitting. Sit on the edge of the bed with your feet hanging for a full 30 seconds. Rotate your ankles in slow circles to activate the muscle pump in your calves, which pushes blood back toward the heart and helps restore blood pressure gradually. Then stand slowly and remain still for 10 seconds before taking your first step. That sequence takes 90 seconds. It transforms one of the most cardiovascularly dangerous moments of the day into a managed, supported transition. It was the single most impactful change Franklin made, and it was the one that stopped his morning dizziness within the first 2 weeks. Coffee is, for most people over 60, not negotiable. I am not going to tell you to stop drinking it. The research on moderate coffee consumption and cardiovascular health is more nuanced than most people expect, and there are studies that suggest modest protective effects from regular coffee intake. That is not the conversation I am having with you here. The conversation I am having is about sequence, about what comes before the coffee in the first 10 minutes of your morning, and about what coffee does to a cardiovascular system that has just completed 7 or 8 hours without a single drop of fluid. After a full night of sleep, your blood is at its thickest. You have been breathing steadily for hours, losing moisture through exhalation. You have not consumed any fluid. The result is that by the time your alarm goes off, your blood viscosity is meaningfully higher than it was when you fell asleep. Thicker blood means the heart must work harder with every beat to push it through the vessels. It also means that clotting factors, which are naturally most active in the early morning hours, are operating in an environment that is more favorable to clot formation. Coffee, in this context, is a mild diuretic. It stimulates the kidneys to excrete more fluid. In a body that is already mildly dehydrated from the overnight fast, a cup of coffee as the first fluid of the morning extends that dehydration rather than correcting it. It gives the cardiovascular system nothing to work with, while simultaneously amplifying the burden on the kidneys and the heart. The change is simple. Before your coffee, drink 1 full glass of water at room temperature. Not sipped slowly over 20 minutes, drunk. The entire glass before the coffee is poured. This single sequence change begins thinning the blood within minutes, reduces the morning clotting risk, and gives the kidneys and the heart the fluid they need to begin the day's work before the coffee arrives. Franklin had been drinking coffee as his literal first act every morning for 15 years. Putting a glass of water before it was the change that took him the least time to implement, and that he described as immediately and obviously beneficial. This is the habit that surprises people most when I describe its cardiovascular consequences. It does not involve food or drink or physical movement. It is simply looking at a screen. And yet, for adults over 60 managing blood pressure, it is one of the most consistently underestimated amplifiers of the morning cortisol surge that I see in clinical practice. Here is the mechanism. When you wake up and immediately check your phone, you are exposing your brain to information, stimulation, and often emotionally activating content. News, messages, notifications, social media, at the precise moment when your stress hormone system is already at its daily peak. The cortisol and adrenaline surge that occurs naturally during the waking process is designed to prepare you gradually for the demands of the day. It is a biological on-ramp. When you flood that on-ramp with information and stimulation before your nervous system has had a moment to orient to waking, you are essentially flooring the accelerator on a cardiovascular system that was just beginning to manage a hormonal surge. Research on what is called cognitive arousal upon waking has found measurable differences in cortisol levels, heart rate variability, and blood pressure between people who allow a quiet, gradual waking transition and those who immediately engage with screens and stimulating information. For adults over 60, whose cardiovascular response to stress is less elastic and whose blood pressure regulation is less precise, the difference between a gradual and an abrupt morning cortisol peak is not trivial. The change I recommend is specific. Give your nervous system the first 10 minutes after waking before you look at any screen. 10 minutes. That is the entire intervention. Use those 10 minutes for the breathing, the gradual rising, and the glass of water from habits 1 and 2. By the time you check your phone, your nervous system has had a moment to transition. The cortisol spike is still present, but its peak has passed its steepest incline. Your blood pressure is in a better position to manage the additional stimulation. It is not a dramatic change. It is a 10-minute delay. And for many of my patients, it has been one of the most impactful changes they have made to their morning blood pressure profile. This one requires a careful and precise explanation, because I am not telling you to stop taking your blood pressure medication. I am not telling you to change when you take it without first speaking to your prescribing physician. What I am telling you is that how and in what context you take it matters for its effectiveness. and that a specific common pattern reduces its protective impact at the moment when that protection is most needed. Many blood pressure medications, particularly ACE inhibitors, angiotensin receptor blockers, and calcium channel blockers, are absorbed and reach their effective concentration in the bloodstream faster and more reliably when taken with food rather than on a completely empty stomach. When taken on an empty stomach immediately upon waking, some of these medications are metabolized differently, their absorption is less consistent, and the effective blood pressure lowering effect may be delayed or reduced during the critical early morning window when the cortisol surge is driving pressure upward. There is also a specific concern with diuretic medications, which are among the most commonly prescribed blood pressure treatments for adults over 60. Diuretics work by increasing fluid excretion through the kidneys. When taken first thing in the morning on an empty, already dehydrated body, they begin removing fluid from a system that is already under hydration stress from the overnight fast. This can exacerbate the blood viscosity and orthostatic hypotension issues we discussed in Habits 1 and 2, creating a compounding morning cardiovascular burden. The conversation I am recommending is not about changing your medication. It is about having a specific discussion with your doctor at your next appointment. Ask them, in the context of your particular medication and your particular cardiovascular profile, whether taking your morning blood pressure medication after your glass of water and a small amount of food would improve its effectiveness during the morning surge window. That conversation is worth having. It is clinically relevant, and it is one that most patients have never initiated because nobody told them it mattered. This is the habit of omission rather than the habit of commission. It is not something harmful that people are doing. It is something profoundly beneficial that almost no one is doing, and whose absence represents one of the most significant missed opportunities in morning cardiovascular management that I see across my entire patient population. Slow, deliberate breathing activates the parasympathetic nervous system, the calming branch that counteracts the cortisol and adrenaline surge of the morning waking period. This is not wellness language, this is physiology. The vagus nerve, which runs from the brainstem to the heart, is directly stimulated by slow, deep exhalations. When the vagus nerve is activated, it releases acetylcholine, which slows the heart rate, dilates blood vessels, and measurably reduces blood pressure within minutes of the breathing beginning. A study published in a peer-reviewed cardiovascular journal found that adults over 60 who practiced slow breathing, defined as 6 or fewer breaths per minute, for 5 minutes immediately upon waking, showed measurably lower morning blood pressure peaks, compared to controls who woke and immediately began their normal morning activity. The difference was not marginal, it was clinically significant, and it required no medication, no equipment, and no cost beyond 5 minutes of deliberate attention. The specific practice I recommend to every patient who asks about morning blood pressure is this. Before you get out of bed, before you reach for your phone, before you do anything else, take 10 slow, deliberate breaths. In through the nose for a count of 4, hold gently for a count of 2. Out through the mouth for a count of 6. The extended exhalation is the key element. It is the long exhale that most powerfully activates the vagus nerve and drives the parasympathetic response that counteracts the morning cortisol surge. 10 breaths, approximately 90 seconds. Combined with the gradual rising from Habit 1 and the glass of water from Habit 2, this creates a complete 90-second to 3-minute morning cardiovascular protection sequence that costs nothing, requires nothing, and can be started tomorrow morning. Franklin added this practice after we discussed Habits 1 and 2, and he described it as the element of his new morning routine that felt most transformative. Not because it was dramatic, because it was the first thing he had ever done that made him feel like he was actively working with his cardiovascular system, rather than simply reacting to what it did. 5 habits, 5 changes, none of them requiring a prescription, a purchase, or a significant investment of time. Let me give you the complete morning sequence that addresses all 5 simultaneously, in the order that makes the most cardiovascular sense. When your alarm goes off, do not move. Stay lying down and take 10 slow, deliberate breaths. In for 4, hold for 2, out for 6. This activates your parasympathetic nervous system and begins counteracting the cortisol surge before it reaches its peak. That is habits 5 and 1 beginning simultaneously. After the breathing, roll to your side and push yourself to sitting. Sit on the edge of the bed for 30 seconds. Rotate your ankles slowly. Then stand, hold still for 10 seconds, and walk to wherever you keep your glass of water. Drink the full glass before anything else. That completes habits 1 and 2 in sequence. Do not check your phone for the first 10 minutes. Let those 10 minutes belong to the breathing, the rising, the water, and the quiet transition from sleep to waking. That is habit 3 addressed. Then, after you have had a small amount of food, whether that is a few crackers, a piece of fruit, or the beginning of your breakfast, take your blood pressure medication with food and water rather than on an empty, dehydrated stomach. That is the conversation to have with your doctor about habit 4. The entire sequence from alarm to medication takes less than 20 minutes. Most of that time is time you were spending on your morning anyway. What changes is the sequence, the deliberateness, and the understanding of why it matters. That understanding is what makes it sustainable. That understanding is what Franklin carried back to his cardiologist. And that understanding is what this video is designed to give you. I want to hear from you in the comments. Which of these 5 habits did you recognize most clearly in your own morning? And which one surprised you the most? The answers you leave help me understand what to focus on next, and your honest reflection on your own morning routine may be exactly what another viewer needs to hear to finally make a change they have been putting off. If this video gave you something you are going to act on tomorrow morning, please share it. Share it with your spouse, with a sibling, with anyone over 60 in your life who takes blood pressure medication and has never once thought about what their first 30 minutes of the day are doing to their heart. The information in this video costs nothing to share and may matter more than any medication review. Subscribe for more honest, research-grounded conversations about protecting your cardiovascular health after 60. Next time, we are going to talk about 8 warning signs that your heart is under silent stress. Signs that most people dismiss as aging and that most doctors miss because they only appear in the spaces between clinical appointments. That is a video you will not want to miss.